All right, guys, in today's video, I'm joined by someone who I've wanted to speak to for quite some time. It's Dolores Cahill, and her science background, her degree is in molecular genetics, and her PhD is in immunology. Dolores, welcome to the show first.
So I suppose what people should be aware of is that there are, first of all, in all of our bodies, there are hundreds of thousands of different viruses in our bodies. And it's important that for our natural microbiome, that we actually come in contact with bacteria and viruses. And so this just shows that every year, we'll say in the Northern Hemisphere, in the winter time, there is a flu season. And the CDC are just showing that this year, from we'll say week 48 in December of 2019 to the beginning of April, or the middle of April, the 12th of April, there were 3 circulating viruses globally. And the first one was influenza B, the second one was influenza A, and the third one was this COVID-19 virus. And that generally, viruses circulate the globe within about 3 or 4 weeks. And so we've already had 3 viruses circulating, and COVID-19, this is data from America, was circulating, had its peak on the 22nd of March. And that means that people were probably at peak infection 10 days before, so the 12th of March. And then the population in America cleared the virus, most of them, within 10 days, and then the virus is gone. And so these results were presented on the 17th of April and from the 12th of April. So there is absolutely no need for lockdown. Now, what I'm happy to say is that people in immunology knew that there was actually no need for the original lockdown, because it was well known from China that the 50% of the people were over 80 in China and in Italy and around the world. And there were countries that didn't lock down, like Taiwan and South Korea. This was already in February and March. So we have never in the hundreds of years of infectious diseases quarantined healthy people. Yeah. So because they knew that this affected, so some actually influenza viruses can affect young people, right? But it happens that this one affected elderly people. But what's really shocking, and what I want to publicize, is it's well known in immunology, you can take preventative measures to boost your own immune system, so that even if you were a little bit malnourished or run down, that if you take vitamin D, vitamin C, and zinc, your immune system will be boosted. And also if you eat good nutrition, so that if you come across the virus, you will get it, you will have hardly any symptoms, you will clear the virus, and you will actually contribute to the immune people. So if you were to say to quarantine people for just in their homes, elderly people for a few weeks, then the other 90% of the population would come across the virus. About 80 or 90% of people, if they protect their immune systems, will not have any symptoms. They won't even know they have it. And then the virus will not circulate anymore, so that when the elderly, which could have been the end of April, come out of the quarantine, the virus is actually stopped in its tracks, right? So you can see that when influenza B had cleared the globe from that graph, it's not there anymore. And the reason is that the immune system clears this virus, it's gone. And people develop immunity. And it turns out as well, which is very significant, is the first, so this is the severe acute respiratory disease, was SARS-CoV-1, was in 2003. And this is now called, the other name is SARS-CoV-2. So in 2003, that circulated the globe. And they initially started to have a bit of a scare, but the World Health Organization has said that globally, the number of deaths from the first SARS in 2003 globally was 770 deaths. 770 in the world. But what that means, and there has been 2 more circulating since 2003, and when I looked into it, between 7% and 15% of the global population already had antibodies to these viruses. So that means what Ireland, RTE, and people are calling the number of cases, that even before this COVID-19 came, if you tested people for antibodies, between 7 and 15% of the Irish population would have had antibodies. So in our case, you would have 400,000 people. So what they're reporting is the number of cases of like 400,000 trying to scare people. They're actually people who developed immunity to the last SARS virus, and they would have immunity now. And also for, we'll say, the other 90%, a lot of people might have low level of antibodies, and it's also understood that some blood groups mightn't actually have antibodies in their serum, but actually the virus doesn't get into their cells, so they haven't developed immune response. But when they see COVID again, they are some of the people that have no symptoms because they don't have the receptor for the virus.